Great. So welcome everyone. As you get settled, I'm going to invite Chris up to share some good news just before we kick off this grand dance. Thank you, Chris.
Thank you. Hi, everyone. I always like to announce great news, and I just heard that one of our lead CAs got into medical school and will be starting at Rutgers in the fall. So, Jen, can you stand up? We're so proud. This is years of hard work, and we just wanted to congratulate you. So, thank you.
Congratulations and welcome everyone to this grand round session. My name is Andrea DeLuca and I'm the Deputy Director of the Institute for Global Health Sciences. So happy to have you all in the room and welcome to everyone online. We're hoping this is going to be an engaging session around women in leadership. So really thrilled to have you all here. The goal of our session today is to review some of the evidence we have around invisible work, and then ideate some ideas for solutions in this room and with our stakeholders online. So I'm going to tell you about the format for today. We have two wonderful speakers who I'll introduce in just a minute. We have a distinguished panel of UCSF Women in Leadership. So we have our Executive Vice Chancellor and Provost here, and really wonderful faculty from the School of Nursing, School of Medicine, and then the UC Institute for Global Health. So, UC Global Health Institute. There we go. So, what we want to come out of today with is ideas for how we shift the paradigm for women in leadership. And so to start us off in an evidence review, we have two School of Nursing faculty. So Dr. Jenny Liu is a professor in health economics. She's also the director of the Institute for Health and Aging. And then Dr. Tracy Lin is an associate professor and the chair of the Nursing Faculty Council. You're both very welcome to come up and kick off this section. So thank you.
Please, Tracy, join us. Thank you. Thank you, everyone. Wow, this is a crowded room, so amazing turnouts. IGHS really gets it done. I'm so pleased to be here, to be invited to share with you our findings on a multi-year effort that we have been pursuing in the Senate. For those of you who don't know, UC has a policy of shared governance between faculty and administration. And on the faculty side, it is through the Academic Senate. And here locally on campus, our Academic Senate has a bunch of committees. So this work was born out of the COVID era, if you remember back in those days, where a lot of faculty were feeling burned out. And at that time, I was chairing the Committee on Faculty Welfare in the Senate. And so we spearheaded this effort to figure out, well, one, how do we solve the burnout? And two, how do we figure out how to solve or reduce the persistent inequities that we actually see on campus year after year in salary inequities, as well as well-being and climate inequities across gender and underrepresented minority status? And to what extent does that actually lead to our burnout issue? So thus is born this work on invisible work, and to answering the question, to what extent is there minority tax here on this campus in academia? So thank you, and I'm going to let Tracy kind of show you all the top line results.
Thank you, Jenny. Thank you, Jenny, and thanks for everyone for joining us today. Allow me to show you the results from our study on invisible work and minority tax in academia. To start, let me set the background and define the keywords. Invisible work here is defined as work that is uncompensated or undercompensated or not recognized or rewarded. Existing studies in the literature do not adequately capture the type of invisible work or the value of invisible work, as well as variable participation. We don't have a good idea on what type of invisible work are being done in academia. Minority tax is a terminology that was originally used to characterize the extra responsibilities assumed by minorities. We know that faculty members who are underrepresented in health professions engage in more service activities than others, and this is documented in various studies. COVID-19 has disproportionately hindered the career trajectories of underrepresented minorities because of all the extra work URM, underrepresented minorities, are doing, and this is also documented in the study. So when we started the study, as Jenny mentioned, it was during the COVID era where faculty members are burned out, overworked. So what we aim to do was to document, evaluate, and quantify faculty member time use in a range of university-related activities. We want to identify systematic disparities among UCSF faculty in performing invisible work. Here is the summary slide of our findings. We like to showcase the findings at the very start. So what we found in our study is that Black, African American, and female respondents from our survey study were significantly more likely to engage in invisible work, and we'll talk a little bit about this going forward. Our discrete choice experiment quantified invisible work and also minority tax. What we found was that each hour of unpaid service activities performed is approximately $139 per hour tax on those who perform them. And this is a high level of opportunity cost that is, importantly, distributed unevenly. Sorry, can you not? Okay. Ladder rank respondents prefer more hours in service and teaching, mentoring over research, clinic, and administrative work. We also found that those engaging in uncompensated service reported higher satisfaction. However, the respondents who reported higher satisfaction also reported high levels of burnout. So people are enjoying the work, but they're burned out from doing them. We also identified pull factors that encourage faculty members to stay at their job, and one of them is flexibility to align research with personal values. There are, however, various push factors that is making faculty members question their decision, including gaps between aspiration and reality, sense of exclusion, as well as lack of recognition at their work. A little bit about the study. So we conduct a survey recruitment between November and December 2023. The survey was met with overwhelming interest. We were able to recruit 616 respondents for the main quantitative survey. And once respondents completed the main quantitative survey, they have the option of opting into an optional discrete choice experiment survey, as well as future in-depth interview. The sample size was determined by the analytical needs for the discrete choice experiment. We included all faculty members of all rank series and time effort above 0%. The respondents were offered a $50 gift card to minimize invisible work and for the quantitative survey, and an additional $50 gift card for the discrete choice experiment survey, and a $100 gift card for participating in the in-depth interview. The discrete choice experiment survey design essentially aims to capture the implicit and explicit preferences of individuals. Respondents are shown two situations with the same characteristics and asked which option they would prefer. Analysis then reveals relative importance regarding of attribute and their levels in decision making. On the right-hand side of the slide, you can see the attributes and levels included in the discrete choice experiment design. Essentially, we asked faculty members to pick how many hours they prefer to work in each of the university-related activities, and then ran analysis on their response. What we have here is the documented self-reported number of total hours work amongst faculty respondents in our survey. The dotted line there is the 40-hour line. And so you can see most faculty members are working over 40 hours per week. Excuse me. in most of those hours worked, majority of faculty members reported engaging in some formal service activities. Most of them do service in their hours worked. Amongst those who perform service activities, we found that, amongst the respondents, we found that compared to female faculty members, male faculty members have 47% lower odds of engaging in service activities. And compared to non-URM faculty members, URM faculty members have 1.5 times higher odds of engaging in service activities. So women and underrepresented minorities are engaging in more service activities than others. We also found that majority of those who teach at UCSF are not compensated. So 535 out of 616 respondents engage in some sort of teaching activities. Many faculty members found their work personally satisfying, but feel burned out. So here you can see when we asked the question if they find their work personally satisfying, 86.6% of the faculty member either strongly agree or agree to that statement. However, when we asked if respondents agree or disagree with the statement, "I feel burned out by my work," 49.7% either strongly agree or agree with that statement. In our discrete choice experiment, we also run a willingness to pay analysis to determine how much respondents are valuing the work and would be willing to accept the work at a specific value. And what we found is that faculty respondents are willing to be paid $125 per hour for 10 hours of clinical work, $100 per hour for 10 hours of research work, this is per week, and $139 per hour for 10 hours of service work. A lot may ask, well, service work are typically uncompensated. How come faculty members are assigning a higher value to it? And this makes a lot of sense to us because when faculty members engage in service activity that's uncompensated, they are taking the time out of doing what they would otherwise do to be paid. So there's a high opportunity cost to do something that is not paid and not be able to do the work that would pay you. So there's a very high opportunity cost there that our study found female faculty members and underrepresented minorities bear. We also conducted in-depth interview, and just to quickly share with you some slides of what faculty members have shared, we found intrinsic pull factor, what's drawing faculty members to want to perform the work they do. And as mentioned before, it's about the freedom UCSF give them, allowing them to do the work they want to do that aligns with their personal value. There are, however, various push factors that is making it difficult for faculty members to enjoy their time at UCSF, leading them to feel burnout. One of it is how faculty members feel the DEI movement is forward on the surface, but when you dig deeper, they feel that it's mostly performative. External push factors also include that the discrepancy between what they're asked to do and what they're paid. So UCSF tell faculty members they must teach, but they don't say that you must get paid when you teach. So if one doesn't teach, they're not doing their job. If they do teach, they might not get paid for doing the job. Another one is regarding clinical responsibilities. The main comment that we hear over and over again is that clinical faculty members are doing their job, treating patients, keeping patients alive while teaching student learners. And it's multiple jobs that they're doing at once, and they're not being compensated as such. So those are sort of our main findings, and looking ahead, we are currently evaluating mechanisms to enhance intrinsic and extrinsic pull factors to make faculty members want to stay, as well as mechanisms to mitigate push factors that's pushing faculty members away from academia. We have initiated a Senate time use study task force that is pending approval. We're presenting it to the Academic Senate tomorrow, and hopefully it'll be approved. And the charge of the study is to make invisible time visible so we can accurately and appropriately compensate those who do it. Thank you.
Now I'd like to invite our panelists up for a discussion. So I suppose, when I call your name, do you want to walk this gray carpet? First we have the promenade. There we go. Dr. Katherine Lucey, who is our Executive Vice Chancellor and Provost. Welcome. Thank you. Dr. Kelly Taylor, the Director of the Center for Pandemic Preparedness and Response. Welcome. Dr. Madhavi Dandu, a Director of UC Global Health Institute. Hi, Madhavi. Dr. Katherine Van Loon, the Director of the Global Cancer Center. And I am assuming this seat is for Thank you all for being here today. And I know maybe one of the first questions that the audience might pose is, we're here at IGHS, so what does this all have to do with global health? Well, I think one of the big reasons why people are drawn to global health is that we want to uplift our partners around the globe. And in order to do that, we also need to recognize that there are structural components to fueling inequities that are both abroad and here at home. And one way to help sort of think about how to reduce those inequities is to start here, right in our backyard, and think about how we can do things in a better way that also puts UCSF forward in a progressive and proactive institution that values equity more globally. So I have a few questions for our panelists, and then we'll invite the audience to chime in afterwards with your questions. And also for those who are online, we have several people monitoring the chat, so please don't be afraid to type. The first question is about the role of mentorship in academic medicine, and this is directed towards Dr. Madhavi. Mentorship is often highlighted as a key to success for women in global health in academia. From your work with UCSF faculty and global health, how can mentorship programs be designed and supported to be more inclusive and equitable, ensuring they support women from diverse backgrounds, and especially those in LMICs who experience intersectional barriers? Sorry, that was a loaded question to start off.
It's okay. Thank you so much, and thank you everyone for being here. I thought I'd start actually for a second stepping back, and because you highlighted a comment at the end, which is my framing for my thoughts on this relates to the intersectionality piece. Fundamentally, everything I'm going to talk about, or the ideas I'm going to bring up, relate to women in this particular conversation, but I think you could extrapolate it in many different ways to other identities, people with other mixed identities, and across borders as well. And I'm also going to make a different comment at the end, which I think relates. But so what are the challenges that we face in this setting? Of course, there's what we all think about, which is the unconscious bias that we are all aware of that exists around several communities. So when you think about women in particular, we have a duality, especially in the health or in global health in general, where the majority of people who are either studying or providing care in global health or even doing the work in global health are women. And they're seen as really good at that role because we have a bias of our identities as caregivers in the global community and in the United States. And yet, I think the one fundamental question that we always ask is, what is it that makes it so that we're not often in positions to make decisions in those settings, either on how resources get allocated or, advancing in terms of leadership or having power in the settings that we're in. So bias, I think, is a key part of that. But I think that there's also this framing that has to do with what we think of as the skills and strengths to make good decisions and the kind of ways decisions are made. So although this is a bit, may be considered stereotyping, there's a lot more community-oriented, shared, horizontal leadership and decision-making that happens in communities led by women around the world. And so when it comes to mentoring in particular, probably one of the first steps in academic medicine will be, or in this academic environment, is to reframe why we're mentoring in the first place or who we're trying to mentor for. In my experience, this is just personal, a lot of times with mentorship, I have met some amazing people, and a lot of it is, how can you be ready to apply for XYZ position? How could you move up in your own division, in your department, in whatever piece of work? And I appreciate some of that and the sponsorship kind of opportunities. But I think it fundamentally fails in the end to change the environment, because many of us are not reaching or wanting to reach for those positions because they don't align with our values in the first place. So that's one part of it. It's like, what are our motivations? What are our biases? And then I think that we're going to spend a lot more time talking about the invisible work piece. But the invisible work piece in mentorship, when you're talking about mentoring, it's not as helpful to talk about invisible work in the work environment, because most women are doing invisible work in every environment they're in, outside in their community, whether that's volunteering at kids' schools, in their neighborhoods, in organizations. So when you think about work-life balance and you're just talking about work as a mentor, you're pretty much in a situation where you're ignoring, you're not even helping the person balance in the first place. So in the research that I've done, the 2 or 3 ways to think about it are, of course, the usual trading around bias and unconscious bias and having targeted recruitment. But there's one other area that's been really interesting is the idea of group-based mentorship or mentorship communities, because that already, first of all, breaks down some of the hierarchies that exist. You can have near peers in the group, people with lots of experience, people with less experience, but you kind of break out the hierarchy of expertise. You basically say everyone who's in this room can mentor each other because they've had different experiences, and as a group, you can multi-source, and you get to have more intersectional identities. And that's probably one of the most interesting models that I've seen out there in this conversation. I would just close by saying that I love the conversation about mentorship, and like, it doesn't really matter if you don't change the structures in the first place. So if the work that you're trying, like the roles you're trying to reach in these places are not compatible with living life, whatever that might be, or compatible with what that is, like if what you're searching for is not really what's compatible with what you're looking for, it doesn't really help to mentor. So I think if there aren't structural changes made in what jobs look like, what's valued, who's honored, how people are compensated, then maybe the mentorship part is like the little Band-Aid. Okay, that's all.
Thank you. Speaking of, building on that, this next question is for Dr. Katherine Lucey about addressing the invisible work in academic medicine. So studies, including the one we just presented, have shown that underrepresented faculty, especially women, disproportionately bear the burden of service work. Not that you have the solution, but I'll pose the question. How can academic institutions better recognize and compensate for this invisible work? And what structural changes are necessary to address it so that we can be exemplars for our global partners?
Yeah. I don't know about being exemplars for our global partners. I think that's your all's expertise. That's not my expertise. But so I want to double down on what Madhavi said. This is not a university only a problem. This is a society only problem. And it's not new. It has been in existence since Adam and Eve. And I think we have to realize how inbred it is to expect women to do invisible work, underpaid work. Our entire economy for decades was based on women doing invisible work at home, unpaid work at home. And now our economy is based on women doing invisible work and visible work at work. So I think there are some really entrenched issues that we have to think deeply about. And we have to be willing to redesign our workplaces. And I'm gonna say workplaces in general, not just universities. I'll talk about universities in a minute. To be fit for purpose today. I mean, the policies and procedures, when you talk about anything from the compensation plan for a department to merit and promotion process, to policies for childbearing, child rearing, elder care. Most of those, until recently, have existed since the mid-1900s. I just love to say that. When you say it's like in the 1900s, I feel like I should be wearing a hoop skirt or something like that. That was just, 10, 20 years ago. And at that time, the workforce looked entirely different. The workforce in universities in particular was predominantly white men. We didn't have a large proportion of minority faculty or minority students. We didn't have a large proportion of women. And so literally, although people look at policies and procedures and think of them sometimes as laws of physics, they're not laws of physics. They're not carved in the tablet from Moses. They're literally rules of men. Literally rules of men. And so it's our obligation as an institution to sort of systematically rethink those policies and procedures by which we recruit, recognize, reward, sustain, promote all of the people who are working in this environment with all of their brilliant intersectionality, right? Because I think I can speak a bit to this as a white woman of a certain age, and yet the experiences of my fellow women who are women of color or trans women are undoubtedly magnified to the negative experiences I've had as a woman traversing academic medicine and different leadership roles. So all of you I know are bearing an incredible burden. I want to thank the men that came today here to hear about this, because I think honestly, you all have to be part of the solution, because you all have to be the ones who are also clamoring for payment for invisible work, and for equity and inclusivity in our institutions. This is not a women's issue. This is a humans issue. And so I think one of the problems we face when we do this work, and it's interesting, is one of the things I have to do is I'm on all these committees. I'm on the apparently co-chair the wellness committee. I find out all these things about my job. It's like, who said? And then I think to myself, is this invisible work? Like I co-chair this committee? I think maybe. And it's a good committee. It's a wellness committee. What is the gender makeup of the wellness committee at UCSF? Guess.
100%.
100% women. 100% women. And first I said, what is wrong with this picture? And they said, look at how diverse we are. We're not diverse. It's only women thinking about wellness. That's crazy. We actually, as an institution, have to demand that everyone participate in these things. And we have to distribute, and that's the most important thing, distribute the work of these invisible jobs, committee work. On the committees, ridiculous service work that I've seen people sort of take on. Oh, I'll do the notes. No, do not do the notes. Let somebody else do the notes. Perhaps somebody who wouldn't expect to be doing the notes. I'll get the coffee. Those types of things we have to sort of say. Our rules of the road for committees are those jobs have to be rotated. And I think that's a really simple thing we could all do, and we have agencies to do that in our own environment. But I do think sort of this expectation that committee work has to be balanced, and that means that we are not asking women to be on all of the service committees. We're not asking women to be only doing the things on those service committees that women typically have done. But we want women on the most powerful committees. What's the most powerful committee in any institution?
The one that handles the money.
The money committee. We want women on budget and finance committees. We have to say to our deans, to our chairs, to our institute directors, where are we? Institute directors, those finance committees have to be at least 50% women. They have to be at least 30% people of color. Those are how you can make big changes. Second most important committee to be on, search committees. And of that, there's a hierarchy. Search committees for institutional leaders, for deans, for chairs, for directors. So the School of Medicine did this experiment a couple of years ago where they required that every search committee for a school level position, like a chair or a director or a dean, had to be 50% women and or minoritized individuals. The number of women chairs went up exponentially after that. So this part of this is actually getting women into roles where they can make those changes to those policies I was describing earlier on, where it does make a difference to have someone in the room. And I remember saying this to several deans ago, I won't say who it was, but we were talking about this committee and they said, okay, we want to get these 5 people. And I said, do you realize those are all men? and they said, no, we never thought of that. It's not in their mindset, it's not a habit of mind. So we have to actually, things that are not a habit of mind and need to be culturally changed have to be changed systematically. You can't rely on everybody to sort of think about that. Same as with merit promotion and invisible work. How do people get rewarded for work in the university? 2 ways, merit promotion or pay. And so what we have to do is figure out how we can document and value things like mentorship, things like teaching. What is something that's the floor for everyone as a faculty member? Because we're not lawyers. We don't charge by every 6 minutes and sort of say, I spent 6 minutes with a mentee, I spent 6 minutes in the bathroom, I spent 6 minutes, but I'm going to attribute that to the mentee. And then 6 minutes with a medical student and 12 minutes with a resident. We can't do that because part of our job is, in fact, to advance knowledge, disseminate knowledge, and educate the workforce that our state and our nation needs for help to advancing health. And so I think we have to change the way we look at these things. The educator's portfolio did a lot of good early in the 2010, 2012 in terms of quantifying what excellence in teaching, what excellence in education makes. We could do the same thing for mentoring. The last thing I'll say is we also have to get good at getting to know. Or getting to not yet, or getting to not now. We sometimes feel, because the way we were raised, probably, how many people in this room are the oldest in their family? Yeah, pretty good. We often feel like if someone asks us to do something, we have to say yes, unless something dramatic, like you're having major surgery tomorrow. And even then we might say yes, but just for 15 minutes, right? So we have to get better at being able to say to somebody, I see you need a mentor. My panel right now is full, but let me connect you to my colleague. And I love the idea of the group mentoring. So those are just some random thoughts. I want to double down on what Madhavi said. We have to change society, not only here, but outside.
Thank you, Dr. Lucey. A lot of food for thought here. And so you gave us a little bit of a glimpse about how complex a faculty member's workload is across teaching, across service, doing research and balancing clinical work. So this question goes to first to Katherine and then to Kelly. How do you actually balance these things? So thinking about your leadership, and Dr. Katherine Van Loon is heavily involved in clinical work. So speaking of that context, you're balancing clinical work, research, leadership responsibilities across the board. What changes can institutions make to better support women who are navigating these multiple roles without experiencing burnout and allowing you to advance your career?
I could talk for the rest of the hour on this. I have definitely said multiple times over the past few years that the triple threat is under threat. And I definitely grew up in an era where in academic medicine, being an extraordinary clinician, researcher, and educator was the dream. Right now, we're in an institutional climate where we are hiring full-time clinicians and paying them more than the traditional academic clinician, and that's that's a big change in what the priorities are. I think all of us who go into healthcare or into medicine probably have selected this path because of passion, and that's how we fuel ourselves. And passion can be from the work that we do at work, or it could be work that fulfills us outside of work. But I think for many academicians, the passion is at work. And I have sustained myself through a mid-career period that overlapped with the pandemic, overlapped with a huge caregiver burden with older parents and very young children, by having passion projects. And I'm really good at program building. I built the gastrointestinal survivorship clinic for the Cancer Center. I founded the Gender Equity Committee for the Cancer Center in the midst of the pandemic, and I built the Global Cancer Program. Speaking of invisible work, I get paid for 0.5% of one of those roles, and I'm expected to fund the rest of my time to do that work. And that's exhausting. And it also contributes to how we feel valued as faculty. How do we navigate that? And I'm going to share a very raw recent experience, but it's very raw and very. I think it illustrates a lot of these points. I was notified in July that I had been nominated by our large oncology professional society for an editor-in-chief role. And to me, this was a dream job. It would be a 5-year plus an additional 5 years, so a decade-long appointment to steward the preeminent journal in my field. And I was required as part of my application process to make a statement that I had institutional support. So I notified my institutional leaders. They said, yes, in principle, we're supportive. I'm sure there's a lot of very qualified applicants. So just write something hand-wavy that you're supported, which I did, and I applied. And it was an arduous process, and I was notified in September that I was named editor-in-chief of JCO Global Oncology. And in the response, I got a congratulations, followed by this amounts to an external volunteer activity. And we can't support you in this role, and we need to be consistent across faculty members for equity reasons. And that shook me to really consider what support I had from my environment. And to answer your question, what would I have done if I was that leader on the receiving end of this, of a prominent national, international leadership role that a faculty member of mine wanted to take? And the missing ingredient in my mind was sponsorship. And it was a very easy solution to me of how can we support you, rather than just telling me flat out, no, this is external volunteer activity. This scarcity mindset that we can't do for one person if we can't do it for all, although there weren't a lot of other editors-in-chief in the field. And I think this we need to create room and space in our environment to give women an opportunity to lead, structured processes. And the reality was, I knew for the next decade I couldn't take on a 10 hours per week, weekends and holidays and evenings, additional work, that I needed to carve this out of my time. And unfortunately, there wasn't really space for my self-advocacy in that. So I share that because I do think it illustrates kind of what some of our institutional structural barriers to leadership are.
Thank you for sharing that, and I'm really sorry that you had to struggle with that. If you still need a sponsor, I'm here. Dr. Kelly Taylor, I want to build on that a little bit. So, you know, a lot of us are driven and motivated here because of the work that we do and the potential impact that we have. And so, you know, one of the findings is that a lot of faculty derive high satisfaction from the work that we do, which is great. I mean, that is exactly what we want, intrinsically motivated people. But burnout is also high. What the heck? And this is particularly hard for women and faculty involved in global health. So how can we strike a balance between personal fulfillment in service and research and the need to avoid burnout, especially when the work involves, community engagement, which is a lot of time and sweat on the ground?
So I think this is a real important question in terms of the balance, right? And so we all are driven to this work, as you said, because of a high satisfaction, or we have passion projects or things that we want to accomplish in the global space with our colleagues. I think a lot of women are driven to this work, especially because of that. You see disenfranchised communities, and you want to be there to help and support. But I think people recognizing what burnout looks like is also critical. And some of that, like burnout is not just a singular process. It's a process that goes through stages. And initially that burnout may be feeling like very high satisfaction. You may think that it's synonymous with, I'm doing great work, I'm super charged up, I'm very focused, and this is something that, is important to me. And not to discount any of that, but that also, it can be the beginning stages of burnout. And so then you begin to feel, as time goes on, you may feel then more chronic stress, right? And you're like, oh, it's just, I'm still feeling satisfaction, but there's a lot that goes into doing this work and balancing my other responsibilities. And as you keep going along the continuum, you get to a place perhaps of being totally disenchanted, feelings of depression, feelings of failure, feelings of not being able to feel like you're successful in moving the work forward. And that's when burnout obviously is deleterious. And oftentimes once you get to that point, it's hard to even recover from it or to ask for colleagues for support, ask your institution for support, because this is not something that we're good at doing, right? And we're supposed to be highly skilled and highly driven. And vulnerability is not necessarily a characteristic of that work. Although as women who are a part of, service is very much a part of our roles in our personal lives and in our work lives, that vulnerability comes natural. But you don't feel like you can express it if you want to then demonstrate that you're successful in what is oftentimes a male-dominated space, especially at the leadership levels. So I think, we've heard a couple of examples of really good ways of addressing or dealing with burnout. I think mentoring groups, or what I call mentoring villages, are super critical. And so having a group of people, a group of women, especially if you're women, women faculty or identified as female faculty, of others that can support you, that you can talk to about, what you're feeling and what you're experiencing, to get that support is critical to help fill in the gap. I think, Dr. Lucey also said something about being able to say no. I don't think we're necessarily designed to say no. We're designed to carry the burden of the world on our shoulders. And that doesn't stop in our global health work. But we need to be able to find the ways to say no. And that may mean asking your colleagues, like, how do I say no? Or is there someone else that can take on this work? Or talking in your groups and in your departments and divisions about, these are some of the tasks that need to be done. Like, who can help support this labor, often invisible labor? And doing that before it gets to the point where you feel like you can't say no. So I think we take on roles, and I've done it many times myself, so I'm not, preaching something that I haven't experienced. Taking on roles and then saying, oh, this is a lot. So now it's the 11th hour, and I got to figure out how to either deliver or feel like a failure. And how do I pass this off, or how do I then, ask other people to stand in the gap and help support? So I think that's where mentoring villages are helpful, because it can help you be more accountable to what your goals are and what you should be focused on. Also helping you figure out how to balance your time. I think that's really critical, and we don't do it enough, especially when we get to a level where we feel like we're experts. We have to figure out how to, and that made me documenting, literally writing down, how do I spend my time? Like, how much is this extra work going to cost me in time? We know visible work is not going to remunerate you necessarily in pay, but if it's something that I want to do, how many hours extra is this going to take for me to do on top of the work that I'm already doing? So that's a very tangible way of being able to say, you know what, I would love to do this, but I am at 45 hours for the week, and this extra labor is gonna put me at 55. And I just really feel like 55 hours is not something I can do, or 60 hours is not something I can do. Perhaps, you talk to a colleague and say, is this something we can share? Or, just say, no, it's not possible. I think one of the other features of burnout is that, we're often debilitated by the time we get to that space. And again, then we're not certain how to move forward. And in that feeling of feeling failure and not asking for help, we just retreat. And then we look at when it's time to come up with our metrics for, promotion or, merit or being invited to participate in other responsibilities. Folks will look at you and say, whether it's on paper or, articulating and saying, hey, we gave this person XYZ opportunities and they weren't able to be successful at this. Or when you look at their deliverables on paper about what's expected of their role, they didn't deliver on XYZ, their publication count, or whatever the metric is that, you're supposed to be held to, you didn't deliver. And that's when you feel like, externally, someone's telling you you didn't meet the metric, and then internally you also feel that. In global health, I think it's often compounded because, not to say that domestic work isn't challenging, but we see a lot of trauma and we see a lot of folks that are disenfranchised. This can add to the feelings of burnout and feelings of helplessness. And so keeping a pulse on how you're feeling in those spaces as you support communities that, have low resources, that may not be getting the healthcare that they need, that may be up against some, legal issues that will limit what you can do for them. Those are all things that you need to keep a check and balance on for yourself, as to this is the limit as to what I can contribute. And it's not an indictment of my abilities or skills when I cannot rise to the level of the other things that I think these communities need. So I think those are some of the ways that we can really think about how we do our work, how we measure our success, who we enlist to help us, and how we move forward as a collective of women in particular to be successful in our workspaces.
Thank you, Kelly. Clearly we have a lot to say about this topic, but I think we should move on to some questions from the chat. Amir, do you want to read them out? Okay.
Yeah.
Right, and they're directed to a certain person.
All right. Thank you so much. Thank you for the wonderful discussion. I can't say enough about women leadership. So we have one of the question from the chat asking about the how fascinating the result of the study were, and if you're interested to make a similar study assessing the amount of invisible work amongst staff.
Oh, among staff.
Yes.
Great.
I really like considering doing that.
Sounds wonderful. And if they're interested, please come and talk to Tracy or myself.
Yeah, thank you. Can you so, can anyone have a question?
Any questions?
No question. So maybe I should ask another question, my own question about women and women of color, and we always talk about how they are undermined, they don't have access to leadership positions, and and we know a lot of you have provided a lot of suggestions for how can we improve on that. What is holding us back? Why are we not able to do what we know that we can do? And just proactively in the family. Why are we still discussing things from maybe 50 years ago? I'm sorry, but we know how is it happening. Yeah.
I don't know if I have the answer to that, but I do have one thought. I wonder about that a lot. And unfortunately, my answer is going to sound it's the bigger picture in my mind about financial alignment. And this is an issue, as I'm speaking as faculty, it's maybe different. Every faculty member at this institution has to find a way to earn their own salaries, fund their research, do enough clinical time to equal 3% or 5% of your salary, and so on. So when someone gives up a leadership role that's funded, they have to figure out how to refund that 7%, 5%, 10% time. it's similar. There was a question we didn't get to on education, why education's underfunded in a clinical environment, for example. It doesn't really matter because the financial incentives of the actual healthcare system are misaligned with the university's functioning in the healthcare system or academic medicine. So when we're working in a system that is just like, it's driven by the fact that everyone has to earn an income and the university has to survive or the health system has to survive, then even people who are theoretically, philosophically, and maybe passionately aligned, they have to make a specific personal sacrifice. And yes, we all, me in different positions of power, need to make a specific sacrifice. But I might hold on for longer to a role than I want to hold on to it because I can't figure out how to fund another 20% of my time. So I think that's part of it is we have, like, it's a uniquely odd system in health professions in particular. A lot of university faculty, which is very hard jobs at other institutions, it's hard to get the job. But when you get paid, you have a salary, and that salary includes teaching time. That salary includes mentoring time. That now they're overworked and underpaid as well. Well, I'm not saying it's a perfect system, but that's not at all how health systems faculty work. So all of us are working in a system that's fundamentally misaligned with our stated goals and responsibilities. So I think that's a big part of it, because you're asking people to have to figure out how to stay funded and survive in their system.
Yeah, and just as a reminder, the teaching profession has historically been women, and any profession that has historically been women tends to have a tax on it like that. I want to respond to the question about leadership roles because I think the answer is sponsorship. It is leadership roles don't get assigned democratically, and there's almost always a search. But what's really important is if someone has taken you under their wing and giving you the opportunity to lead before your next leadership role. And so when we designed Differences Matters back in 2015, one of the things we wanted to do was to elevate the the reputation of the leaders in Differences Matters. And we brought them to chairs of directors meetings, and we had them at the leadership retreats, and we had them on finance committees and things like that. Because you need to be visible, and you need to actually have someone say, I know this person, I know what she's capable of, she can do this job, and I will make sure she can do this job, because if she needs help, I'm gonna be there. That's what a sponsor does, right? A mentor can advise you through those things, but you really need to sort of hook your star to somebody else's star. And one thing I think is really something that you can do right now is if you see an institutional leader who you admire or who you think has a role that you might be interested in, make an appointment and talk to them. People love to talk about their careers. They love to give advice. Nothing makes them happier. I tell you, there's a lot that doesn't make you happy in leadership roles, so be careful what you wish for. But honestly, start reaching out to institutional leaders, and men and women. I guarantee you, 90% will accept your request. It might not be today, because most leaders have gotten good at saying, not yet, not now, but 2 weeks from now, or a month from now. And that in itself is educational. So I really think sponsorship is a very important thing. And then I want to react to Katherine's really terrible story. And I think the other thing is, I think leadership development courses are really good, but you have to be the leader who you are. And many leadership courses really are about teaching you how to fit in to a current leadership model. And what most of us need now is a different leadership model. We need someone who is actually sort of saying, tell me more about this opportunity that's in front of you. Let's figure out how this fits in to the work that you're doing. What might be some trade-offs that you'd be willing to make? What might be some trade-offs that we'd be willing to make? It's not a yes, no, quick, I like your phrase, wave. I've seen those before. Like, yeah, just say, make a flurry. But I think that when you're thinking about being a leader, it's good to work with other leaders. It's more important to work with other leaders than it is to take a formal leadership course. And I think that isn't to say that those aren't good, but that alone, a leadership course, is not going to get you where you need to be. And it sometimes frustrates you because you've invested all of this extra time. So reach out. There's so many leaders in this institution. You have some in the room here, Dr. Gooseby, Dr. Rutherford, Jenny. I just did something very sexist, sorry. Sorry about that. Jenny Lou, Dr. Lou. But I think that you have some agency here, and don't wait for someone to sort of see you shine. Shine right in front of their face. Yeah.
I just want to add on a little bit and bring this back to the global health context, because this is something I think about a whole lot. And we know that junior women are over-mentored and mid-career women are under-sponsored. And this has been studied and written about that when we are in medical school and we're trainees and even junior faculty, we're perceived as vulnerable, and there's a lot of mentorship available to us, and that dissipates as you become a threat. There was a quote, and this is not a political endorsement, but there was a quote during the DNC about Kamala when Oprah said she knows how to push at the top while lifting up those below her. And I realize that's exactly what we're doing in global health. Our international partner settings are often less entrenched in all of these systemic barriers than we are, believe it or not. And so I have found that it requires me to dig deep sometimes, but lifting up my female mentees from our international partner sites is incredibly impactful because they actually have more mobility than perhaps we do here in the United States right now. Very glad.
I just want to say one quick thing about the woman of color comment that you mentioned in terms of leadership. Well, they're not a critical mass of us, first of all. And I think the other thing that's cautionary for when I talk to my colleagues is like, when you get promoted to a position of leadership, you feel like you can't make mistakes. And so there's a different level of scrutiny if you're a woman of color. And there's just no way to get around that. And so I think women of color are often very cautious about taking leadership positions, making sure that they feel like they're ready and they have enough supports around them. And even then, it still feels risky. So I think that's one of the issues that needs to be addressed.
Well, thank you all. Really, this has been a very lively discussion. Clearly, we've only scratched the surface. If you want to talk more, we have a QR code up on the, well, when the picture goes away, we have a QR code, so please let us know if you want to continue talking.
Thank you all again for being here, and thank you to our wonderful panelists. Your insights are so appreciated. I think we do have some action points at least we can do within the Institute for Global Health Sciences around group mentorship and sponsorship for some of our women leaders. So I look forward to carrying that out. And a huge thanks to Susie Welty for organizing this session. You did a wonderful job. And just look forward to continuing to work with you all and advancing women in leadership. So thank you and have a great afternoon. Thanks to those on the